So Dr. Sudak, just to follow up on what you said in the first video, you mentioned that you use some questionnaires that the patients can complete before they come into the visit, which is helpful because
Right.
it saves time, it focuses you on what needs to be addressed.
Absolutely.
So what advice would you give our audience, or which questionnaires do you recommend that we use in outpatient treatment?
So I send everyone to the same website, which is www.outcometracker.org. That's Mark Zimmerman's website. And what he's done is to collect every scale about every diagnosis that's in the public domain,
Right.
and gotten permission for others. And so you can find eating disorder, ADHD, depression. For me, the idea is something that is validated, relatively simple to use, free.
Yeah.
And so for example, I use the GAD-7 for generalized anxiety. I use the PHQ-9 for depression, and that we want to continue to track that over time. So I think it's also HIPAA compliant if you want to have the patient fill it out beforehand and register, and you can track the patient's scales over time. But I think that's a really important thing to be doing.
And the clinician doesn't have to do anything really, because the patient on their own time, outside
Correct.
of the session, goes to the website, fills it out, and the results get emailed
Correct.
to you.
Or you log on.
You log on and
essentially.
see the
Or
results.
you can just have, if you were to pan the office, you would see there are tons of manila folders all over the office. And what are in that folders are things like those kinds of measuring instruments,
Yeah.
and the forms that I would need.
Yeah.
If you're going to do this in a brief session, you have to have your materials ready for you. So I have activity assignment
Yeah.
planners, and I have
So print out these kind of things,
right in
and
advance.
in
and
advance have them ready so you can
have
pull it
them
out
exactly.
instantly.
And so that I will, even as I begin my day and I have the patients that I'm going to see, I have my charts available to me. One of the things that I'm going to do is even pull the forms I think I'm going to need for that session, so I have them in my lap as I'm talking to the patient.
Okay. The other thing you had emphasized in the first video was that when the person comes in, you start by kind of planning, like, what are we going to talk about, which
Sure.
is the CBT idea of agenda setting. So it seems like you're saying that even in a visit that is 20 minutes long, you should still start by setting an agenda.
Oh, especially in a visit that's 20 minutes long, because you want to make every minute count, right? And the way to do that is to really organize how you're going to spend your time, and what kinds of things you're going to need to prioritize, right? So part of what I want to think about when I'm doing any sort of work, but particularly in briefer sessions, is as I come down the hallway with the patient, there might be some sort of social or chit-chat kind of stuff that's happening, but
Yeah.
once we hit this door, we're kind of all business, and we're going to think about how we're going to be spending our time. And some of the scale scores will help me. So, for example, if I see that somebody's got suicidal thinking and they didn't have it the week before, then obviously that's going to become the bulk of our agenda. Or if their scales went this high, that would be part of our agenda. We have to be really thoughtful about that. But then trying to get the patient also acculturated to, when we come in each week, we're going to spend our time for a couple of minutes organizing and figuring out just how it is that we want to spend the time together so we can maximize its effectiveness on your behalf. So patients know from week to week that one thing that they're going to do is to jot down one or two things they might want to make sure that they're talking about with me, or questions that they've had about their medicines, or particular effects that they didn't want from the medicines that we want to make sure we put on the agenda too. All of that becomes part of how we divide up how we're going to spend our time. So there's no sort of split off between, oh, let's just get the medicine part out of the way.
Yeah.
That becomes equally important to the enterprise of getting better.
Right. So you're saying that instead of the patient feeling like there's pressure, or that we are just going from one topic to another, the patient may actually feel empowered because they will really get the maximum benefit of
Right.
their time with you.
Right, and we actually teach patients that. The active agenda setting isn't just me like sort of setting up all of these paradigms. What I'll do is, in my very first session with somebody, is say, and part of what I'd like to do is just figure out together how it is we want to spend our time together today so we can get the most out of it. And that means that I might suggest some topics that I think might be helpful for us to talk about, and I want to make sure that you suggest whatever topics are bothering you the most or that you want to make sure that we get to today so we can make sure we zero in on the most important things. That's really the purpose.
So that's another aspect of CBT that's very important. The idea of collaboration is not just a word that we use, but really in every session there is an element of collaboration.
Right, that you and the patient are really a team working together on behalf of the patient and on behalf of managing this particular set of problems that they've got.